So then we go to another remedy, euphorium.
So can
Now,
you repeat?
euphorium perfoliatum. Now, this is like an aconite, quick. Everything happens very quick in euphorium influenza type of picture in the first 3 days. So, in bryonia, I said, and in gelsemium, I said, at first it has got a period where you get a little sick feeling, you don't feel like doing anything, you don't feel like getting up in the bed, and then next day morning when you get up, you develop symptom. No. In euphorium, everything comes at one time, quickly.
Okay.
So you have got joint pains, you have got headaches, you have got a feverish feeling, everything comes. Now here is very important. In gelsemium, I use the word soreness.
Yeah.
In bapticia, I use the word soreness. But in euphorium, the patient will use the word as if dislocated. Now, many times you have dislocated your shoulder or some other joint, and the type of feeling that you get, it's a very deep-seated pain, like bapticia. And with this pain, now here comes the key symptom, is restlessness. Many people don't know that eupatorium has tremendous restlessness, and they try to ease the pain in one form or the other by becoming very restless. So the pain is so much that they try to become restless with the pain. So that's characteristic. And another very characteristic that I see, that this eupatorium patients, they never sweat. They hardly sweat. So sweat is only 5%, if you say. But bryonia, they sweat a lot. So that's how you differentiate bryonia and euphorium. So euphorium, as we all know, has got a bony pain, influenza type of thing. But another characteristic is that they, again like bryonia, love cold water. But euphorium loves much more cold water. So lots of ice in the water is characteristic of euphorium.
Okay.
So more ice and less water is euphorium. More water and less ice is bryonia. You can say like that. Then we go to another remedy, which I'm just giving you a few indications.
Yes.
Now, this is the indication not on the very first day. So this is what I want to tell you. So in the first day, I told you what kind of invitation things that we can get. Now we are going to 4th, 5th, and the 6th day.
Yes.
So in the 4th, 5th, and the 6th day, you usually get the larynx affected, the throat getting affected. You will develop an actual fever, and some gastric symptoms will come, mostly diarrhea. Now see, diarrhea is not common in many countries of COVID. I have seen that. Some countries does not have any gastric symptoms.
Yes.
But some countries, like in Thailand, I am in touch with Thai people, but I don't see much diarrhea in them. But in our Indian population, I do see some diarrhea. And then on the 4th or the 5th day, the weakness starts. And by the end of 7th day, weakness becomes tremendous.
Yes.
And this weakness is more in the hands and legs. And the aches and pains are more in the fingers. This is what I saw in COVID patients. And on the 6th or the 5th day, later part, you will see mild breathlessness. Very little. They are talking on telephone. They are talking with somebody. They get this kind of breathless. And the throat complaints are worse while eating and drinking. So these are the COVID symptoms I see. These are between the 4th day and the 6th or 7th day. So I would say rather at the end of the week. At the end of the week. So there is a remedy that I see very frequently that comes at the end of the week, and that is Rux toxicodendron.
Okay.
Because Rux toxicodendron symptoms develop very gradually. It takes time. That's why I never mentioned Rux tox in the beginning for discussion. And Rustock's temperature never comes 103, 104 on the very first day. So on the very first day, the temperature may be 99, and after 3-4 days, it may go to 102. So it's a slow, progressive kind of COVID infection that you will see in Rustock's. But the aching of the muscle and the joint is extremely high from the first day. So that's the characteristic. Now here the muscle as well as the joints are affected, and another thing is that they have a marked sensitivity of their tongue or marked sensitivity of their lips, and they can have something to do with their oral cavity. Either the teeth become sensitive, the tongue becomes sensitive, the mouth becomes sensitive, and it is painful. So they will show you these jaw areas, the mouth areas, and there's a pain. It's not the throat, it's above the throat. This is tender. Now, when you see that kind of presentation, you should be 100% sure that you are dealing a case with Rustock's. And within 24 hours to 48 hours, they get violent abdominal pain. So this is how, when the gastric symptom comes, and the pain is more on the right side, as you all know, that Rustock's abdominal complaints are usually on the cecal region or on the lower colon region, and that is so much tender. And then with this kind of severe violent pain on the colon on the lower side, there is a spluttering diarrhea which is highly offensive, stinking, and mark tenderness of the abdomen. The person is not going to allow you to touch. So this is the remedy between the 5th, 6th, and 7 days.
Yes.
Now here, two things will happen. Now again, we go back to the COVID patients that I see.
Yes.
Here, you will see the fever will progress. The respiration, which was very mild, will become, patient will become small breathless. Coughing will start, basically. And the patient becomes more toxic. This is the time when you should observe what is happening in the patient. Depending on that, you select a remedy. Now, what I do, so I'm just sharing you my experience.
Yes.
So on the 6th or the 7th day of the story, I heard the story of the patient. But between the 6th and the 7th day, if I see the temperature which is rising very high, but the person is very active. So he will read a newspaper, but at the same time, you will see that he has got 103 degrees temperature. He can solve a puzzle, he can solve a Sudoku, he can see a television, but his fever will be high. So when somebody is very overactive mentally with a very high temperature, and they are little loquacious, they want to chatter, they want to talk, especially in the evening hours, this is a case of pyrogen. And then when the fever goes very, very high, they become delirious. Most of the delirium and pyrogen comes in the evening and night and never during daytime. But this is very important, that with very high fever, the mind is overactive. So this is a key symptom, I would say. And generalized body ache, whole body from head to foot, very sensitive to pressure like arnica, so don't come near me, don't touch me, very restless. So at this time, you may confuse this remedy with rustoxicodendron or with arsenic, because remedies come very close to each other. But as I said, that Rustox patient, if you have to really differentiate, then the gastric symptoms are very characteristic in Rustox on the right side, so that you will not see. One more thing I forgot about Rustox, which I would like to add.
Yeah.
Rustox can present with some urticaria or some skin rash with the influenza type of picture. So that I missed out with you.
Okay.
I just recollected. Now, when you see a pyrogen patient, you have to look at the tongue.
Yes.
Now, tongue can be totally dry, there can be no coating, or it can be red and dry, but very painful, full of cracks, and very hot. So the picture of tongue varies in pyrogen. It's not one picture that you will see every day.
Uh-huh.
So I repeat, it can be totally dry, there can be no coating, or it can be totally red, deep red, and dry, and hot, and crack.
Correct. Yeah.
And this is associated, this kind of tongue, when there are a lot of catarrhal symptoms. Catarrhal symptom means when there are a lot of discharges from the nose, from the eyes, from the throat. Now see, this is the time when he coughs and brings out little phlegm.
Mm-hmm.
So pyrogen comes late in the COVID cases after 7 days, but this is how they can present. And involvement of larynx is very common in pyrogen. There is a rawness and soreness and burning in the larynx with sticky mucus in the larynx, and patient keeps on doing try to bring out, and when he brings out, it is sticky, yellow, stringy, like calibi and hydrosis.
Okay.
Some patients of pyrogen complain to me about ringing in the ears. So there's a ringing in the ears, or the ears are obstructed, or the mastoid process is little tender to touch. And it's always the right ear much more than the left ear that I see in pyrogen. Now the abdominal complaints are usually offensive diarrhea with a watery stool. Now books mention about the pulse, that the pulse
Yes.
is and the fever ratio is not proportional in pyrogen.
Yes.
But this is not a must, honestly. Even with a normal ratio, I have given pyrogen and it has acted.
Okay.
So I rather would depend on other symptoms of pyrogen than on this symptom, that the pulse and the temperature ratio is not proportionate.
Yes.
So the remedy that mimics pyrogen in Materia Medica, of course I am telling you my experience, is mercury solubilis. It comes very close. But mercury, if you have to differentiate, the presentation begins in mercury with severe catarrh.
Mm-hmm.
So you will see lot of lacrimation, severe conjunctivitis, burning tears, excoriation, cuts in the angle of the mouth, redness of the tongue, increased thirst, throat pain,
Mm-hmm.
and severe photophobia. If this kind of picture is from the very beginning, remember you are dealing with a patient who needs mercury solubilis. Mercury also has little puffiness of the face. They have a feeling that the ears are choked, the ears are stopped, there is a buzzing sound in the ears are tender, no appetite, lot of ephthus in the mouth, so lot of and again, like gelsemium, the hands are shaky. Hands are shaky, hands are trembling, and there is an extreme amount of heat that radiates from the eyes.
Mm-hmm.
So when you see that kind of picture, you should think of a remedy, mercury. Mercury are also thirsty patients. They may also want cold water to drink. Now remember, in India, the temperatures are always between 27 and 30 degrees. And so thirst is very common in Indian population, let me be very honest. So thirstlessness becomes very characteristic in India.
Yeah.
But I'm talking about other countries where you can see.
If I understand correctly, so mercurius solubilis can also come in some cases right from the beginning.
Yes, it can come, but I have not seen.
Okay.
So now we are going to a remedy which has got a little deeper thing of that. So the patient, now we are going on the 7th, 8th and 9th day, and I see that the patient is more depressed, more discouraged from the very first day, and that is a stage of Kali bichromicum. The face looks pale, there are red blotches on the face, and severely hopeless and discouraged feeling. So for a time being, you may think, oh, is it the aurum metallicum case? No. Kali bichromicum also patients are discouraged and hopeless. They are weak, they are tired, and they will tell you, please allow me to be in peace. Don't enter my room. Don't come to meet me. I don't feel like talking with you. And they are extremely chilly. Kali Bai patients are extremely chilly during this kind of illnesses that I'm talking about. And the worst period is morning, especially between 6 a.m. and 8 a.m. So this is very important. But the temperature will increase in the night between 2 a.m. and 3 a.m. in the morning or after midnight. But in general, 6 a.m. and 8 a.m. is very important. And the Kali Bai illness usually starts not with eyes and nose and face, but directly with the larynx. So they have got hoarseness, larynx with lot of mucus in the larynx. They want to clear their throat all the time. It's a stringy, whitish yellow mucus, and it takes huge time for somebody to bring it out from the body. Then there is a lot of stomach disturbances, or you can say gastric disturbances, nausea, vomiting of a sticky mucus. Again, with this gastric disturbance, they get severe migraines. So if the stomach is upset, the migraines becomes very high. And now the key symptom. Kali Bai patient in this situation will not allow you to shake hands. You know why? Because if you look in the repertory, soreness of the hand, feels sore, bruised, will not allow to shake the hands. They will shout loudly if you shake hands because so much soreness and bruisedness in the. And another area which is sore and bruised is the sole, and that is why they don't like to wear socks. They don't like to wear shoes. They don't like to wear footwear because this is the key symptom: soreness, bruisedness in the hands and in the feet. Now we will go to another situation because now the condition is becoming worse slowly. So on the 7th, 8th and 9th days are the periods where somebody succumbs.
Yes.
Because the situation now is going to be very bad. So first let us discuss the patient, then we go to Materia Medica.